Hi there. This is a brief video to show you some of the checks that are performed when certain medication is issued. This is a test patient, so not exactly typical, but they're on Ramipril, and if I go to issue that, we'll ignore this screen for now, we'll come back to that. It's telling me here to reduce manually their prescription to fortnightly. Ramipril may not seem like a particularly high-risk drug, but if they've not had UNEs in the last 17 months, then it really is starting to get high risk. And so they should have been invited multiple times. So if you're using the recall system, it should have prompted, and they probably have had multiple invites for that. And so the warning here is you need to manually reduce them to fortnightly medication. CQC tends to take a dim view on simply repeatedly inviting patients if at no point do you actually restrict their access to medication. So I've got a few options here. I need to inform the patient. I need to ask them to attend for the tests. So I'm going to click Send SMS. So according to our records, you're overdue monitoring for high-risk drugs. It's vitally important this is kept up to date. Please contact us ASAP to arrange a blood test. And explains that we've reduced their medication to fortnightly. And click Send, and that will then send when I save the record. Now, at this point, I might be confident to amend this myself. I'm not a prescriber myself. I guess I'd need to change the duration to 14 days and the quantity to 14 days. Important I do that. It's important to know the system can't automatically change that. So I need to manually change it. In the background, it's coded here the fact that it's been switched to every 2 weeks and given the reasons why. If you're not confident doing that, or your practice doesn't want you to do it yet, then you need to task a GP or prescriber who can do that. But it's the best way to keep your patients safe. It may not be popular, but you probably will find they start attending for their monitoring. There are various medications that it covers. You can look at the protocol if you wish and see how that works and what's included in that. It should be self-explanatory. If conversely the patient then does have their monitoring tests and they go to issue the medication again, then the system should identify the fact they've been reduced to 2 weekly and prompt you to put it back to monthly. There's also a report that can be run let's go to the right folder, admin to action, put prescription back to monthly. So you can see those that have been reduced to fortnightly or even weekly due to either non-compliance with monitoring or to failure to respond to an annual review invite. And there's a code to add. That's about it. Any problems? Let us know.